You mention in one of your papers the evidence about the insight that you had, that you picked up on the way government didn't look at the harms, and you cite Rishi Sunak, who was then Chancellor, talking about trade-offs. Can you just talk a little bit about that? One assumes that government is really thinking and talking about both costs and benefits to this and weighing everything up and really studying the evidence. But your paper picks up on an insight that demonstrates this wasn't the case.
That's right. So this is an interview that Rishi Sunak gave sometime after, toward the latter stages of the pandemic, and he was clearly frustrated. And you can argue whether he should have spoken out more publicly at the time, but I guess it's difficult. You're in cabinet, and there's a sort of convention that you either leave cabinet if you want to speak out against, or you're there and you take collective responsibility. So, but anyway, the insight into the decision making was very interesting. So he was very clear. He said, well, there were people within cabinet who tried to raise the huge costs of lockdowns and other things going on, and they were really strongly discouraged from doing that. So the way I interpret that, what seems to have happened is that there was this focus on we're worried about the increase in deaths, and we're worried about the impact on the health, so we will just intervene. We'll have lockdowns or whatever we think we'll do. We'll have these I think slightly ridiculous rules about the sort of 10 o'clock curfew for pubs and the rule of six and all these nonsense things that we know had no effect, but they said, well, these are going to reduce deaths in COVID. Okay, and that was their pure focus. How can we reduce COVID deaths and stop health services being overwhelmed? And then they were saying, right, okay, so now over to you, Treasury, and Rishi Sunak in Treasury. Okay, we know these things are not without costs. We're going to do them anyway because we're only focusing on reducing COVID deaths. But now we want you to try and alleviate some of the costs by all this sort of, help for businesses, and economic help for individuals who may have lost their job, and the furlough scheme and so on. But of course, what that isn't taking account of costs in your decision making, because the decision making should say, okay, we're going to take this huge decision with massive ramifications for the whole of society, unprecedented, going to take away people's really basic rights. So we should, at the minimum, look at whether they're going to have benefits, which they never really did. They never analysed whether these things were working, but also we're going to look at the costs. And what Rishi Sunak said, they didn't do that. And in cabinet, they were discouraged from making that as part of the decision-making process. It was more, okay, now we've made that decision, what can we do about it? But of course, what they could do about it was spend a shed load of government money. Government money, of course, is ultimately taxpayers' money. And at some point that, there's a consequences of that. So at some point that money has to be paid back. And we are still seeing the consequences now. It's interesting in the budget. We've just seen that there was lots of mention about the problem of the public finances. We've got no money to spend, so we've got to increase taxes and cut public expenditure in some places. One of the big reasons for that is the billions of pounds, hundreds of billions of pounds that were spent on lockdown and alleviating the harms of lockdown, that we're now facing the consequences, and means there's less money to spend on health, on education, on public services, or we have to increase taxes. So, we're still seeing the consequences of those decisions.
We are. And I think, was it 40 billion black hole? Rachel Reeves says there's a £40 billion black hole in the budget. You've actually put a figure on the amount that was spent on furlough and on lockdown suppression, COVID suppression measures. What is that figure?
Yeah, so you can look at the total amount spent on COVID and lockdowns. It's perhaps over £400 billion. But of course, you can make the case, well, some of that would have had to been spent anyway. So say the government had taken a more Swedish type approach and not lockdown, there still may have been consequences for COVID in terms of health services and so on. So if we take a really sort of minimal approach and say, well, how much did the government spend just on paying businesses to shut down and paying individuals not to work? Then we're looking at perhaps £140 billion. You look at the sort of figures in the House of Commons library. I think that's probably a minimal approach to the costs of lockdown, but at least it's a starting point. Not far off the whole expenditure on the health service for a single year. So we're talking very significant amounts of money, and that's not the cost of lockdown. We're just talking about the cost of government expenditure on paying people not to work and businesses not to open that they didn't have to do. Okay, there's all sorts of other costs in terms of the mental health costs on individuals. How do you identify the costs of loneliness? People sat in their own homes, knowing it as a criminal offence, even to invite one of their friends in for a cup of tea, or young people not being able to meet up with their friends, for months on end. I'm an economist. People think we only think about money. Well, no, we think about all sorts of things. We might try to put monetary benefit, estimates on those sort of things. They are just as important. So, I think the overall costs of the lockdowns are way in excess of, that, for example, £140 billion of governments paying people not to work and paying businesses not to open. But that just gives you some idea of the consequences and, what we could have been using that money for instead.
One might ask, you might not be able to answer this, but we've had in recent history, Asian flu, Hong Kong flu. I know we've had the AIDS pandemic. I know it was a different way of transmission. We never did anything like this before. And we always, as I understand it, had an impact assessment of public health measures until then. Why do you think all of this was abandoned and even suppressed? As you say, there was no encouragement of discussion about the costs of this.
Yeah, I mean that's speculation as to why the sort of textbook or standard approaches to public health were abandoned. So I think we can talk about the sort of panic and what happened in other countries. So you can't discount the impact of China and then Italy. So Neil Ferguson famously said, he was pushing for lockdown, but he never thought in a million years it would get past the politicians until Italy introduced formal lockdowns and he said, oh, we've got this precedent. So, perhaps there will be a way of doing it. So we probably have to go back a little bit further. How did it happen in China and then in Italy? And what were the factors pushing that? And I don't know what they are, but people have speculated in terms of some of the underlying messages that were sort of pushed out. So I think there were clearly people within public health who perhaps had not been happy with the previous approaches and were keener for a more interventionist, authoritarian approach to sort of public health issues. And that's maybe mirrored in the more general approaches to other things, climate change, the approach to public harms of smoking and drinking and so on, and whether you go with a very authoritarian banning and regulation or whether you go for more sort of voluntary measures. So I think there is a movement within some aspects of public health that they want a more top-down, heavy-handed approach to these things more generally. So there's some pressure from there. There was also clearly some panic from government ministers. So you can just talk about weakness. Once you decide to abandon ethics and you don't think about the right or wrong, you are then pretty much lost, because if somebody sort of bombards you with figures and maybe you're not very perhaps able to look at statistics and sort of interpret them and investigate them, you probably should be. And if you're not and you're in government, you should be getting advisors who can guide you through that. But if you're relying on people to guide you through that who are pushing for this more interventionist process, you can see how weak-willed ministers or people without that sort of ethical basis may then say, oh, okay, we have no option. There are lots of lessons there, of course, because the governments were clearly getting a particular message from their scientific advisors. So we had scientists like Neil Ferguson who may have some modelling expertise. We had other scientists perhaps with expertise in epidemiology and so on, who weren't not necessarily experts in policy analysis. And it seems to be that there was certainly a step over, I think, from some of this scientific advice into really being politicised, from actually being used to try to engineer political changes, in other words, interventions. And we saw that right the way through the pandemic, even back to Christmas 2021, when we saw scientists and the government, SAGE and people in their committees, really pushing the government to go for another sort of lockdown or really intensive measures on the basis of their scientific advice. And that's really, wasn't their role, if you like. They were politicising the science. Instead of saying, these are our best guess for the models, by then I think we all knew that the models were nonsense and they weren't being adapted. So, but put that to one side, even if you believe those models, it was quite wrong, I think, for some of those models to be politicised and say, so therefore you should lock down again, which was happening even in, Christmas 2021. And that's, I think pretty inexcusable.
Do you think we need a fundamental overhaul and restructure of the SAGE model, which is based on the sort of biomedical community? Their role is to preserve life at all costs. Models have their limitations because they can't incorporate behavior, people's ethics, people's loneliness. Do you think we need a structure where SAGE has people like you, has economists, has psychologists, has people that can look at this, make a societal response to any new societal threat?
Yeah, so I think there's two things there. Yes, had the government scientific advisory body been broader and brought in social scientists, so I don't know if it's economists, but also psychologists and social policies, are people taking this more of an overview to get to sort of make sure that costs as well as benefits were being incorporated. Yes, that would have been good. Had they had more of a challenge, so just even within that scientific community, there were scientists who were actually questioning this sort of modelling approach and this idea that you're going to have hundreds of thousands of deaths. There were scientists who were questioning this, and at one point the government did sort of very late on, it looked like they were getting at least hearing from some alternative voices, people like Carl Hennigan and people from Sweden and so on.
And you, yeah.
And, yeah, but so that needs to be done. So to say, even if it's just the science side of it, that needs to be more of a challenge. And it's not good enough to say actually that these scientific models can't take account of behavioural change and so on. They can, and that's one of the frustrations, that you had the Neil Ferguson type models in March 2020, which took no account of the fact that people change behaviour anyway once they see, for example, deaths increasing. But a year and a half later, once we had the data and we saw how those models had failed, and not just failed catastrophically, they were still presenting the same sort of models with the same mistakes, taking no account of this behavioural change. And that's a decision of the modelers, as well as the decision of government not to interrogate them anymore. And it took far too long for that to happen. So yeah, there do need to be structural changes, I think, to the advice that government gets and how they take that advice, and absolutely broadening it out, but also making sure there's more of a challenge and challenges more accepted within government.
Yeah, I mean, there was a level of censorship and suppression of alternate voices. Were you among them?
Well, I was an alternate voice, I guess. Was I suppressed? I mean, who knows in terms of social media algorithms and so on. I mean, I was presenting data from a very early stage and, analysing some of the evidence. I have to say at my university, they let me get on with it. I did hear unofficially there were, complaints that came in and, people say, well, how can you have somebody at your university saying this? But I was never told to stop doing it. So I think that's credit to the university. Interestingly, by the way, once I started publishing the data and also some analysis on the evidence, I got a lot of private messages, and so quite a lot of these messages were from people in the health community, so doctors and nurses working in hospitals and also in medical schools, including some from my university. And actually, the message I got from lots of these was a little bit different to the experience I had. It was not always agreeing. Sometimes people disagreeing or challenging certain things, but a lot of the case it was saying, yes, I recognise what you're saying. That fits in with what we're seeing. That lockdowns were not perhaps necessary. That there's a broader aspect to this. We're not being seeing the whole picture, and the data isn't being presented fairly. But I cannot speak publicly. This is what these people were telling me, because if I speak publicly, I fear I will be at risk of losing my job, or there's pressure from different universities not to speak publicly. So that clearly was a problem, and that's really, really worrying, because okay, bad ideas can go around and people say the wrong things and people misinterpret data and they misinterpret evidence, of course. But actually, the best way of tackling that is having full transparency and openness, allowing people to speak openly. And it was one of the great tragedies of the pandemic policy that so many people did feel not able to speak up and to speak publicly, particularly in the public health community. We'd have ended up in a much better place had there been more open debate and criticism. And I think it's actually a bigger picture. You see this a lot in all sorts of controversial areas where people, do disagree. Actually going back to Brexit, to climate change policy, to all sorts of things, where the approach tends to be, well, rather than encouraging open debate, we're gonna just try and shut things down. There's only one sort of acceptable approach to doing this, and with COVID, it was, we've got to save lives, and anything that sort of criticises lockdowns or mandates or this is going to risk saving lives. So we can't have debate on it. But of course, raises a question: is that how sure are you of that evidence? This new, huge, really intensive and invasive policy. Why are you so sure it's going to save lives? If you don't have that basic debate and you should try and shut it down, you're never going to have the challenge, and you're never going to, if there are flaws and weaknesses, you're not going to improve policies. So yeah, this suppression of alternative voices was a real tragedy, and it was real. Even, I think perhaps I had a relatively good experience, but I know people who were formally disciplined by their university, or were told, one case, somebody had published a paper and they were told, well, if you carry on speaking about this publicly because it's not very favourable to lockdowns, then you've got to watch out. You may be looking for promotion soon. So you've got this sort of unspoken message that it's not in your interest to speak out. And we heard that time and time again, and certainly in other countries it was worse. We saw petitions against people in the United States who were speaking out against lockdowns from their own community, their own academic community in Stanford. It was just crazy. In Australia, DG Foster in Australia is an economist, really good economist who's was speaking out on lockdowns, had a different view, was talking about the costs. She had a real, I think you can only describe it as a pile-on from other academics and economists criticising her, saying how dare she speak out. It was really, really appalling, I think, how the academic community as a whole reacted to different voices, and lots of lessons for us to learn, I think, there.
I was speaking to someone very recently who was very senior in government, advising government on public health measures. And I put these things to them about why didn't you listen to other voices and senior people who were suggesting alternative measures. And they said that, well, if you have the chief medical officers, World Health Organization, and the major scientific establishment saying one thing, then it's nigh on impossible to take on board so many other voices. What would you say to that?
That is simply not true. And we know that's not true because not everywhere did take that approach. So, for example, Sweden, and by the way, I've got quite a lot of criticisms of the Swedish approach. They didn't do nothing. They did, quite a lot of interventions and sort of more on the voluntary side that we can question whether they had an effect. But fundamentally, they didn't go down the lockdown route. They never had formal mask mandates, for example. They didn't force people to stay at home. They didn't shut down hospitality venues. There was very limited school closures. So they went on an alternative approach. So you could, and that was based on good scientific advice from their health advisors. You did not have to take the sort of lemmings approach and jump off the cliff along with everybody else. Similarly, in America, you had, one of the advantages of America is you've got so many different states with different approaches. You had somewhere like Florida, where, for example, quite early on, they did go down the sort of lockdown approach, but very quickly rode back. And round about from September 2020, they said, OK, we realise that was probably a bit of an error. We're not going down that route again. Schools are opening and they're going to stay open. We're not going to have statewide mask mandates. We're not going to have statewide lockdowns. And they were very much criticised for that. But clearly now we can see that they had the better approach to somewhere like California. So we have these other examples. OK, California was a bit later on.
Better approach in terms of excess COVID deaths?
In terms of all sorts of things, in terms of excess mortality, but also in terms of reducing some of the costs from these unevidenced lockdowns and mandates and so on.
And many scientists, just to interrupt you, would say our British public would never have behaved as the Swedes behaved and listened to their government and obeyed their government because we're a rebellious lot.
The evidence simply is that is not the case. We can see, looking back, there were huge changes to behaviour before the formal lockdown in, towards the end of March 2020. So, people changed their behaviour quite a lot. This idea that you had to have this sort of law, actually, you look back, and that's clearly not true, because we can look at the pattern of infections, and there's the work by Professor Simon Wood, showing that infections were decreasing before all three of the national lockdowns in England. We can debate whether that was due to voluntary behaviour change. There was clearly some element of behaviour change. I think other people think, well, actually, you've got this sort of natural wave of infections that seems to follow the same trend, whatever you do and however you respond. But to the extent that voluntary behaviour change had an impact, a causal impact, there was behaviour change very significantly, and you can see that in the States as well as in the UK. There's some formal, economic evidence looking at how people change their behaviour, showing that actually that was the dominant change relative to the behaviour change caused by legal changes. You can think of that, sort of human nature. You can think of somebody who's perhaps living with an elderly person who they think might be vulnerable from COVID. And you think, well, okay, deaths are increasing. I'm a risk. I'm going to take some precautions and perhaps not go out to the pub quite so much. And you compare that against, say, students perhaps who are living together and, all young people not at risk, serious risk from COVID. They might think, well, okay, I've already had COVID maybe, so I've got some immunity, and they'll carry on going out and won't change their behaviour. So you get that sort of natural change. So the behaviour change that happens is probably the more important ones, because the people who know they're more of a risk or they're more of a risk to other people tend to react and take more behavioural changes. So you get this big effect from voluntary changes. So when you have a law that says, okay, now nobody can go to the pub, everybody's got to stay at home, that has very little impact, because the ones you're mainly affecting are those students and young people, or those people who've already had COVID, and it's not going to have an effect anyway because they've already got immunity and they're less risky to other people. So there's lots of reasons why the sort of mandatory effects, even though they have a big effect on people, so they have big costs, and big costs on hospitality and so on, they have a much less of an effect in terms of the benefits, in terms of reducing infections.